Hello, everyone, and welcome to today's webinar, Setting the Precedent for Artificial Intelligence and Full Laboratory Automation. I am Morgan Sterling of LabRoots, and I will be your moderator for today's event. Today's educational web seminar is presented by LabRoots and brought to you by COPAN Diagnostics. To learn more, please visit copanusa.com. This webinar is educational and thus offers free continuing education credits. Please click on the continuing education window at the bottom of your screen to obtain your credits after the webinar. We do encourage you to participate today by submitting any questions you may have during the presentation. To do so, simply type into the Ask a Question box and click Send. We'll answer as many questions as we have time for at the end of the presentation. You may also submit any technical issues here as well if you have trouble seeing or hearing the presentation. This is a replay of our live presentation given in June of 2022, but we will have a live Q&A session with our speakers after the broadcast concludes. I'd now like to welcome our speakers. First, we have Dr. Kileen Murphy, who is the Clinical Lab Director for H&L Lab Medicine. We have Dr. Kileen Shier, who is the National Science Director of Microbiology and Donor Testing at Quest Diagnostics and leads the company's microbiology best practice team. We also have Dr. Susan Sharp, who is the Scientific Director of COPAN Diagnostics. We will now begin the broadcast.
I'm very pleased to announce our first speaker, Dr. Kileen Murphy. Dr. Murphy started at H&L in December of 2019 as the Scientific Director of Microbiology. At the same time, WAS Lab arrives. So that was a nice gift. Subsequently, she has taken on the role as the overall Clinical Lab Director for H&L Lab Medicine. And clinical interests include expanding the laboratory's role in clinical decision support and quality improvement projects such as standardization and reduced turnaround time.
So I'm going to talk a little bit about our experience with automation. I'll introduce you to our lab a little bit to see how it kind of compares to yours and if it's if you can make kind of the same assumptions about how it might work in your laboratory. Talk about some of our key points in the decision to implement automation. A little bit on the improvements we've seen with the WASP lab, and then I'll dive into some of the studies that will be featured in posters tomorrow on the Calibri, one of the newer pieces of equipment with the COPAN automation line. So as mentioned, we're located in Allentown, Pennsylvania. That's about an hour and a half north of Philadelphia, for those who don't know. Not a tourist mecca, but it is the third largest city in Pennsylvania. We have a large health network as our primary owner that's based in Lehigh Valley, but they also have 5 hospitals north of the Lehigh Valley, so they serve also a very rural population as well. We also have another hospital that we serve down near Philadelphia that's outside of our network. We have about over 1,100 employees throughout, again, all of our acute care labs, our core lab, our patient service centers. As I talk about the automation, Georgia, our manager, couldn't be here tonight. She's joining the conference virtually, but because when I came, WASP was already on its way. So a lot of this work to get this approved and a lot of the dedication to showing the lab the value of this to make this investment is thanks to Georgia. So our microbiology department is staffed 24/7. So we do read urine cultures and blood cultures on all shifts, not just positive bottles, but we try and work up and set up AST on all shifts as well. And so that's one of the big drivers of having automation added to our laboratory. So some of the general reasons we wanted automation. If you're going to look at automation, obviously you're probably going to do your due diligence and look at everything that's out there. We wanted to have the quality results, so hopefully we're not in a unique situation where someone comes up and says, well, I got some Staph aureus growing on this plate, but not on this plate. What do you want me to do? Where you have to go back, look at things, replate things, look at the gram stain. So really that traceability from beginning to end was something that we were looking at. We wanted to provide actionable results. Again, as I'll talk about it a little bit, but it was a chance to change some of our workflows, make sure we weren't overworking things, and kind of really change a culture shift in our laboratory with this introduction. Decreased turnaround times, again, that's something that's really important to us. As a central lab, it's also important to be able to get our results out quicker because it takes our samples longer to get there. And we want to stick to our central laboratory model. Again, there's a lot of arguments about centralizing and decentralizing and pros and cons to both, but we feel pretty strongly about this model. We also have kind of a strategic vision for the lab as well as for our hospital system. So this was, when we added the lines, we built it with the idea of growth in the future. So additional hospital systems from our network and additional labs that we would like to hopefully manage. And then, of course, everyone is dealing with a limited labor market. And so to be able to reduce some of the employee time spent plating cultures and even reading cultures, as we'll talk about as we go through, is extremely important. Excuse me. So when it comes to COPAN in particular, we felt that the technology was superior. What was available today, what we could purchase, was better than what was maybe promised for the future. We wanted to be able to integrate with our other vendor platforms. So we have a fairly diverse lab, but we do use a lot of equipment from one other vendor that would integrate really well. One of the things that was huge for us was the flexible inoculum. So prior to the WASP, we did use the Previ Isola to plate our urine cultures, and that was an instrument that could only plate 10 microliters. We felt like it really contributed to overworking urine cultures, and so we really wanted this flexible inoculum. So with the WASP, when we put on a urine culture that's a clean void, it'll plate it with a 1 microliter loop. When we plate the next one that's a straight catheter, it'll go to a 10 microliter loop. And it also has the option for a 30 microliter loop as well for some culture types. Phenomatrix was extremely important as well. So this will sort out our cultures. It sorts out our growth, our no growths. For our urines, it'll separate out our contaminated. Even we have 2 different contamination codes, and it'll sort those out for us as well. And then we'll talk a lot about the Calibri as we go through, but the ability to add that at the same time was very important to us. We did take our technologist input, so they went around to some of the labs and on some of the site visits to kind of get what they thought, because it is a big change. We have had people who we have lost because they didn't necessarily like that. Again, with the last 2 years and everything going on, you can't certainly pinpoint one thing, but there was a lot of changes that came with this. And then we did actually ask the lab for a vote as well with what they had seen and what they learned, what they would prefer in terms of automation. So what are the improvements we've seen? So first, the specimens are plated quicker upon receipt into the laboratory. So I know there are improvements, especially with micro, that can be difficult to measure. This is one we could specifically measure. So when we looked prior to the WASP lab over a 6-month period from the receipt to our micro setup time, so the time somebody should have actually gone under the hood and plated it, it was close to an hour, which is quite high, but we do consider urine cultures to be kind of the lowest priority, so at the same time, it kind of makes sense. When we went to post-WASP lab, our receipt to micro setup time, and that micro setup time is actually sent from the WASP to our LAS, so we know it's the time it really went on, not the time somebody scanned it to say they plated it and then maybe got distracted, and that dropped down to 19 minutes. Same thing from the setup time to the final result was at 29.4 hours for our urine cultures, and post-WASP, when we looked at the 6 months post-WASP, it was down to 25 hours. We scheduled this times for screening and reading based on the specimen receipt patterns. So when we first got the WASP, everyone was sitting there like, oh, 3 urine cultures are coming off, better wait. So we actually scheduled so that they're not sitting there and screening and reading at the same time. We looked at when specimens arrive, when they're plated, when they should be coming off at 18 hours. And now we have assigned screening and reading times to kind of reduce that wasted time of going to get one plate that's positive at a time. And then we were able to shorten the first read and the overall turnaround times with that uninterrupted incubation. So when we did our validations, instead of reading 20 hours or 24 hours, we were have all of our first reads at 18 hours. And there is an ability to take that lower, but that's what we felt comfortable with at that time. And it's probably something we'll reevaluate as we continue. So looking at urine cultures in terms of our overall turnaround times, again, for no growths, the manual time to final report was a little over 24 hours. When we looked at the first couple of months after implementation, that went down to 21 hours. And then when we looked at it 1 year, it was down to 18 hours. And so we've had a really significant reduction for no growths. We saw a similar pattern for our positive growth cultures. And this is all comers, so it's even contamination, things that maybe just go out as yeast, call for further workup. So that's why it's still pretty low. But again, we were able to reduce those times really well. And we also have it so that on first shift, if you read a urine culture with the VITEC is what we use for our AST, it goes into a rack and it's looked at 10 hours later, so we can send out the susceptibility results quicker as well. So some of the other kind of harder to measure improvements is it expanded the opportunity for our off-shift technologists to learn to work up other culture types. So we do urines. It's hard to get people on second and third shift. Everybody knows that. They get a little burnt out. I'm reading the same thing every day. I'm getting bored. And so with the addition of this, the cultures are coming off all the time. One of the things we introduced is that anybody could send out a no-growth culture. So get used to looking at wounds and other culture types as they're coming off so that people can see that. We utilize the WASP lab images for culture review and education. So somebody calls about a contaminated culture, I can go in and put in our container ID and look at a picture and give them a little bit more information, talk to them and see if they really need it worked up or what we should do. We also take subsets of, and we send them out to the whole lab and say, what would you do? What would you report this out as? What would you work it up? It's all anonymous, and then we kind of provide education of, 50% said this, but we think this is how it should have been worked up. And again, one of the huge things we really wanted to do was limit overworking of contaminated cultures. People do it with their hearts in the right place, but it leads to a lot of waste, a lot of turnaround times that go a lot longer than they need to, and a lot of confusion, I think. Again, we'll talk about the Calibri with some of the studies that were done that will be presented, but it takes the burden off of spotting MALDI-TOFs off the bench technologists. So we can load the plates, make our, what we call our pick points for those who aren't familiar. They come right off the WASP lab. We can take them, put them onto the Calibri. The Calibri does the spotting, puts the matrix over it, and all we have to do is make the QC spot and load it onto the instrument. We've actually added 4 hospitals, as well as additional non-culture based testing. For micro, we don't do the bulk of the COVID testing, but that's obviously the biggest one that's been added because we do a lot of the rapid turnaround time requiring COVID tests for discharges and things like that. And again, with the quality improvements, that traceability, being able to go back, look at a plate. We like to do the 0-hour image. So as the plate goes in, we take a picture so that if there's any concern about contamination, we can go back and look at that. So again, I think the quality improvements, while hard to quantitate, have been really, really impactful with this addition. So for the Calibri, again, this is kind of a newer, although I think we'll hear about some other newer things as well, addition to the suite of instruments that you can purchase for the WASP and the WASP Lab line. And so this automates the picking of colonies for MALDI-TOF and for AST preparation. The MALDI plate spotting and the matrix overlay for both the bioMérieux and the Bruker mass spec was FDA cleared in December of 2021. And then the McFarland AST has been submitted to the FDA for the VITEC in February of 2022. The Calibri will also make the purity plate when it makes the AST suspension as well. So for some of the studies, so this was a study with H&L and with Kaiser Permanente in Portland. So Kaiser Permanente in Portland supports 3 hospitals as well as 35 clinics and has about 25 micro FTE and does 161,000 cultures a year. So we combined our data looking at how the Calibri performed for MALDI-TOF spotting So you can see overall, we had 87 gram-positive organisms, concordance of ID, where an ID was obtained by both manual spotting and the Kolibri was 100%. We didn't have any discordant identification. We did have 2 organisms that gave no ID when the Kolibri spot was done, a Staph hemolyticus and a Gamella. The Staph hemolyticus was repeated and it was identified by the Kolibri the second time it was spotted. The Gamella was non-viable, so we weren't able to repeat that. We had 155 gram-negative organisms. All but one of those gave an ID by both methods, both manual and by the Kolibri spotting. So overall, again, concordance was 100%. We had one that didn't give an ID. It was a Klebsiella pneumonia that was extremely mucoid. When we spotted it on the Kolibri, it did work. So this is a poster out of Kaiser Permanente in Chino Hills. So much larger laboratory supporting 17 hospitals, over 200 clinics, and doing over 1 million cultures per year. They did a similar study looking at the overall accuracy and concordance between the MALDI spotting done by the Kolibri and the spotting done manually by trained techs. So overall, the accuracy was 99.1%. So they had 2 discrepant results that they saw where manual spotting gave an identification of Streptococcus and the Kolibri gave an identification of Proteus. On investigation, they think that most likely what happened is that the incorrect plate was tested. For a second one, they had a Rayutella by manual that was identified as an Enterobacter by the Kolibri that really there's no known cause. Again, what's great to me about the WASP lab is you can go back if you see some sort of discrepancy and look at what the plate looks like on the instrument as well. If you don't have it anymore, there's something that happens. Overall, 10 of the 228 isolates that were spotted by the MALDI or by the Kolibri for MALDI-TOF gave no ID. For all of these, as you can see on the bottom, a majority of them being gram-positive organisms, repeat testing wasn't performed. And then finally, another poster from Dr. Bryant from Kaiser Permanente in Portland looked at the AST portion of the Kolibri. So it looked at a total of 1,673 drug-bug combinations with 106 organisms that were tested. They had 11 discrepant results for categorical interpretation. So the overall categorical agreement was 99.34%. They had 9 of them were minor errors and 2 major errors with no very major errors. So again, the percent of overall agreement was extremely high. And then they had overall essential agreement again of 99.7%. So again, very high agreement, what we would look for when comparing one method to another. So overall, happy to, I think at the end, we're gonna take any questions or talk about our experience with the Kolibri. But the MALDI performance of the Kolibri, you get a high level of concordance between manual spotting and automated spotting. And again, with the studies, you kind of, I guess, probably tend to favor our better spotters. They don't really ask, our not so great spotters if they want to participate in something like that. So I think in the real world, you'd actually probably get even higher, a higher identification overall with the Kolibri, perhaps than with various spotters in your laboratory. The Kolibri is an accurate method as well for the preparation of these spots. So very few discrepancies were seen. And for some of them, there was some explanation that was available for that. The AST, the Kolibri automated performance, is equivalent to manual methods and used for susceptibility testing on the VITEC 2. So overall, it's another piece of equipment that frees up technologists' time for valuable tasks. It standardizes the MALDI plate spotting and AST preparation. So again, all done by an instrument, not a lot of variability from person to person. And then it gives you that full traceability as well.
So our next speaker is Dr. Kileen Shier. Dr. Shier is the National Scientific Director of Microbiology and Donor Testing at Quest Diagnostics, based in Chantilly, Virginia, and the chair of Quest Diagnostics Microbiology Best Practice Team. So thank you very much, Dr. Shier, and over to you.
All right, thank you. I will be speaking to you about our experience with high-capacity microbiology automation. So my talk will go over the expectations we had for automation, two approaches that we had with two different installations in our institution, some challenges, some results, some future opportunities. So before I get started, I want to say that this was not Quest's first venture into laboratory automation, looking into automation, everything from stainers to plate streakers. We had a variety of different instruments, sometimes just at a few locations, sometimes a lot of instruments at a lot of locations. So we had quite a bit of experience in terms of the pitfalls with automation, the benefits of automation. And we actually even had a prior experience with the total lab automation system. So we were pretty concrete in what we were looking for in terms of expectations. So we knew with our size and our complexity, we really needed a platform that could be tailored to fit our needs, that could fit our volumes, our configurations, our testing protocols. It needed to be able to be something that could work for our sites and the variations even within those sites. We were also looking for flexibility. Things evolve over time, and we needed a system that could evolve with us as our protocols changed and updated, as our volumes changed, something that we could adapt without having to, scrap the whole system and start over again. We had learned from our past automation experiences how important reliability was, because we became very reliant on the technology, especially from a labor perspective. So we needed that automation to be consistent or we were in trouble. We, of course, were looking for a reduction in labor, as we have the previous speaker already discussed, and as all of you know, medical technologist labor is becoming harder and harder to find, and I'll talk a little bit more about what we achieved in terms of labor savings. We, of course, are always looking for reduction in turnaround time. As Caitlin mentioned, we're a reference laboratory. We're already losing time in getting the sample to us, so we want to make up as much of that time as we can while still providing quality lab results. And of course, we're looking for quality improvements, trying to reduce some of those errors that occur because people are people and they're not perfect. So our two approaches, our first installation was actually at a fully operational laboratory. So that was exciting and had its own challenges, which I'll speak more about in a minute. The second installation, we had the unique opportunity that we were building out a brand new clinical laboratory, all disciplines, not just microbiology, but that gave us a chance to build essentially our dream microbiology lab with automation in mind. Now, in both cases, we took the same validation process. So we started just with water runs, literally running tubes of water through and making sure, it didn't get stuck along the way. Did the doors work? Did the belts work? Just very much a mechanical validation. Then we moved in, and that was after our factory acceptance testing. Then we moved into seeded specimens using ATCC strains, just making sure we recovered growth, looking at, mixed cultures. Could we find, a Staph aureus that was buried in an E. coli, that type of thing. Then we actually did our clinical validation using de-identified remnant samples tested in pairs, with our automated method and our manual method. And then finally, we loaded it up with as much volume as possible and saw at which point we basically backed up the system. So in the first installation, as I described, this was already a fully operational lab. This particular location had been operating at that location for about 8 years. So the challenge was, how do you stand up a new system while also keeping the day-to-day work going? And remodeling the building was not on the table, so we knew that the system we implemented had to fit within the space, within the lab, as it existed already. We really didn't have a lot of extra space or swing space, so this became a dance. Move a piece here, you re-verify that, okay, put in this piece. Okay, move a piece here, re-verify that, put in that piece. And so that led to multiple phases of installation because of that lack of swing space. So that did drag out the validation timeline because we had to break it into so many parts to keep our functional laboratory functional. So one of my favorite pieces of the system is the collaborative workstation. And so we use this for our non-standard specimen types. We have done a lot of client education trying to get them to move to a liquid-based medium, but clients can be very stubborn and opposed to change. And some of them have just not got with the program. So of course, we still get non-e-swabs and we still get sputa, and currently we're getting stools in carrier transport medium. So we use the collaborative station for those specimen types that can't go onto the WASP flow automated sorters and down that line. And this has a nice 5-axis robot if you haven't seen it before. But what I really like is when you read the sample, it knows what plates you need to plate, it puts the barcode labels on, it brings them out, and it lifts the lid. I don't know if any of you have ever had this experience, but I have, where we're going to work something up and a tech forgot to set the McConkey or whatever other plate, and you're going, how did you forget the McConkey plate? But this instrument prevents that from happening. I also really don't want to think about how many times plates are mislabeled by people in a clinical laboratory. We don't know. I would be terrified to know, probably you would too, but you don't have to worry about that because this is labeling it and it's only opening that patient's plates that are being plated right at that moment. And then it takes those, it can feed it down the line, or if it's something that's incubated offline, it can put it into the canisters for you to take, say, for example, your anaerobes. So that's why I love this robot, is quality, error prevention is really high with this. So now let's move on to our new construction. So again, there were very minimal design constraints. It was, what do you want the microbiology lab to look like? And while we had work going on at another location, there was no patient testing being performed in this building at that time. So we didn't have to do that, instrument shuffle as we were installing. So that really simplified things. We were able to design the optimal workflow as we saw it and install everything in 2 phases because we weren't having to work around, med techs with plates and incubators, etc. So now I'm going to talk about some of the improvements we saw broadly in categories of laboratory management, front-end processing, incubation, culture reading, and then culture workup and reporting. So as far as laboratory management, we already had a number of reports that we could use with our own proprietary laboratory information system. But this has a couple of nice features, one of which is you can set it up to send automatic emails to like our corporate email addresses. So key people wake up every morning and they have a system report, how's the system doing? What's the workload? How many plates came in? How many have been read? So it has all of these metrics and data that in the past, you'd have to go look at the bench and you'd guesstimate, like, okay, they've got 3 stacks, they've got 5 stacks, so now we have quantifiable data about the system, about the workload, about when the plates were ready to read versus when they were actually read. So as you're looking at your staffing models, somebody leaves, you get the opportunity to hire someone else. Okay, where should we slot them in so that those plates are being read as soon as they're ready to optimize turnaround time? It has tracking on components. Is there a particular belt that, is giving an issue that would show up on these reports? And then there's this real-time system dashboard. So we have a very large installation here and at this particular location, and all of the alarms sound the same. So without this dashboard, you could be standing going, okay, where is that coming from? So this dashboard allows you to see exactly which line needs your attention so you can go quickly resolve that issue. All right, so as far as the front end processing, we do have the WASP flow systems. So for our liquid specimens, our e-swabs, our urine and gray tops, we can just dump them into the flow. It does all of the sorting. It's sending them to the WASP platers. When it's done, it actually prepares them to go bank them for storage. And so we're really not handling, literally we take them and just dump them in. It doesn't look very classy, but it's really quick. So it also eliminates those barcode labeling errors that I was talking about with the collaborative instrument, right? You don't have that human interaction. You've got an instrument that's consistently labeling things. It's consistently inoculating the plates the same way, streaking the plates the same way so that you get nice isolated colonies. And it immediately goes into the incubator with that little small door. If any of you have the continuous monitoring temperature systems on the big incubators, you know what happens the moment you open that door. It starts alarming and annoying everyone because the temperature's just all over the place. With this little door, it just goes in, no fluctuations. And then I already talked about the specimen storage. It gets them ready to go so you can just take it to your storage location. So The incubation, I think, is maybe one of the more underappreciated elements of this system. So each plate basically has its own heated air curtain around it. So all of these plates, in addition to not having that big door open and close, each are being basically individually incubated. So if you think about it, that's like making like little tiny mini muffins versus, making a big cake and the center's not quite done, but the edge is already starting to burn. So this way, everything's getting incubated uniformly, and we have found that this really enhances the growth. It's allowed us to validate shorter incubation times with equivalent results. Again, getting results into physicians' hands faster than we could with the manual incubation. We also take time zero pictures as well as subsequent images. So that's very helpful to see what was on the plate to start with, what's on the plate later. Can also be helpful if there's like an overgrowth, you've got a Proteus decided to take over the plate, you're trying to see what was there before the Proteus expanded. So that can be very helpful for us as well, looking backwards. All right, so our images are taken at predefined times that we have validated to be optimal for our workflow, and we use the Phenomatrix artificial intelligence system. So basically, this system, I'm going to speak more about it in a minute, but it has been modeled based on our work, our pattern, validated against our manual methods to essentially screen our plates for us. So just like your techs, they sit down on the bench, what's the first thing they usually do? Pause, neg, right? They sort them out, work up their negs, work up their pauses separate, maybe their mixed growths are somewhere in the middle. That's what this system is doing for you. So it gets everything sorted out so that when your tech sits down to work on it, they know, okay, I'm working on the no growths, I'm working on the mixed, I'm working on the positives. Again, I've already talked about we can pre-review images. This is really good for difficult cultures overgrowth. And this technology actually enables remote reading, which that's, many people's dream retirement job, right? I'm going to sit in my fuzzy slippers and read plates from home. All right. So I talked a little bit about our reduction in turnaround time. So we have been able to validate a shorter incubation time for some of our cultures. And what's really cool about the no growths is once the technologist has confirmed their no growths, so everything's still in the technologist's hands, those plates go to the trash. The technologist never touches the negative plates. And so that's a lot of time savings when you think about it. They're only handling the positives. The Phenomatrix tag really, speeds up their handling because everything's kind of pre-grouped for them. And this helps training with new techs because you can start them on, okay, and Caitlin shared, okay, everybody can learn how to do no growths. Doesn't matter which culture, we can teach you how to do that. And then you can show them because you've got images of interesting things, but also sometimes it's just that repetition, right? Seeing it over and over and over again. You can use some of your prior plates to just get them familiar with how things should look as you're training them. So we also have the Calibri instruments. I'm not going to spend too much time on these because Caitlin did a great job reviewing these. And focus a little bit more on the Phenomatrix. So this is an example of our strep culture. It does take, this WASP lab system takes pictures with 2 different lightings, so you can really see that nice hemolysis. There's the eye here, so you can actually look at the patient demographics. It does have them grouped. If you don't agree with how it called, you can use the drop-down arrow and say, no, this, I don't agree. I mean, in this case, you would not say this is no growth, but let's say it was, oh, that was just some junk captured on the platelet. That's no growth. I can change it right there. You can set up essentially your Phenomatrix to be, if you will, custom folders. So these initials over here, some of them might mean something to you, some might not. Those are basically taken from our SOPs. So they're meaningful to our techs. They know that these are different workups that need to be done according to our standard SOPs. So they know when they're setting down what they should be looking at, what should be in the GAS versus an NGA, etc. You can set up, you can customize how many plates you view at a time. So if you're reviewing no growth urine cultures, you can set it up so you're reading a lot more plates going through. The techs can zoom in at any time. If there's anything they see that they don't, they're not sure about, they can zoom right in and look at that. And you do have to confirm the number of plates before you release it out so that you can't go, oops, I didn't look at that bottom row, that you are confirming you're reading all of those plates. So again, with the phenomatrix tag, once you have confirmed that yes, you want to do ID and susceptibility on the Colibri, the system will say, here's the colonies it suggests for ID on MALDI-TOF, here's the colonies it suggests for susceptibility testing, but you can move these. If for some reason you didn't like what it picked, you can move these around and send that to the Colibri. So when you get the plates on the Colibri, it's going to prepare your MALDI spot, it's going to prepare your suspension for susceptibility testing with the colonies that the technologist picked. So challenges. One of the biggest challenges is this is a new way of doing microbiology. You know, gone are the days of going to the incubator, pulling out your stack of plates, physically sorting through them. That's a very tactile clue as to your workload. Now it's really digital. Your queue is digital. How many are in this folder? How many are in that folder? And so it's learning to use those digital dashboards, those digital metrics to judge your workflow as opposed to what's physically in your hands. So that's a little bit of a mindset shift for all of us. The interface development. So we do have this interface with our laboratory information system, and like every interface I've ever been a part of, it took longer than we thought. That just seems to be how it goes. So it is interfaceable. There's a lot you can do with it, but when you're considering a validation, just bake into it that there's always something with an interface. And then preventative maintenance and instrument operation. Microbiology is kind of like the last place to go automated, right? We don't generally have a lot of high complexity equipment. Our staff aren't as used to a lot of equipment, and so they had to learn how to deal with the automation and the type of maintenance. So it's wiping down tracks and cleaning sensors. That's not something that micro staff have historically had to do a lot of, and so it's a little bit of a different maintenance. It's not hard, it's just something different, and so learning how to work differently in the lab. So some future opportunities, we are always looking at what else can we put on the system. You know, what other media, what other culture types that we can build onto the system, what other phenomatrix tag algorithms can we develop with COPAN to automate more of that screening initial step of our cultures. We are always looking for ways to improve our interface with our LIS. In a perfect world, we would do everything in the web app application on COPAN and not really even have to get into the LIS anymore and be able to just send everything out and have it flow seamlessly through. So that's, you know, what we're trying to achieve through various phases. We're of course looking at, you know, additional hardware, and we provide feedback to COPAN. Oh, we like this, but we don't like this piece about the carousel. Could you make it, you know, could you make this, the number of samples on this match this? So providing that user feedback of things that we found, you know, they work fine, but, you know, what could we do to make it even better? We're always looking at, you know, what's the next module, the pipetting module for stool specimens, the new radian module that I believe Dr. Sharp's going to talk about. So looking at what other enhancements, what other things we can put on the system to automate even more. So this is just kind of a summary schematic of the old way of doing micro, if you will, where we start with specimens. Maybe they get manually streaked, maybe they get put on a WASP. They get loaded into the incubator, then they've got to be offloaded after they've incubated. You're going to screen them, then you're going to read them, then you're going to go up set up an ID and susceptibility. When you look at the WASP lab automation, there we are, you dump specimens in, and at the end, you have plates going to the line for the Colibri workup, or if they're negative, they just go straight in the trash and you've never touched them again. So it's kind of amazing to think about how many hands-on steps you have saved. And so one piece I forgot to mention from a labor savings perspective is, in addition to looking at how do we save labor, how do we reduce the amount of technologist time and use more non-licensed time, you know, more lab assistants. So you don't need a technologist to empty the trash with the negatives. Before, our technologists handled the negatives, right? Because they're screening through them. In this, you've now transferred that work to a group that is lower cost and, quite frankly, easier to find and easier to train than our medical technologists. So it's not just a reduction in labor, but also a shift of the labor to a different work group that might be more feasible for us to maintain, especially with our staffing shortages that we're seeing today. So, in summary, It is a pretty long validation process. Obviously, each laboratory needs to define within their own, system what that requirements look like. If you're having to build this up in an operational lab, it's going to take longer than if you are privileged with a new site and you can put it in from scratch. It is very difficult and slow to change client behavior to the systems that are compatible with the automation. So if that's something that you would need to do, plan plenty of time for that as well. Our technologists actually were really quick to accept this technology. You, of course, always have your handful of naysayers, but by and large, they were super excited about this and really willing to work on this. And I do think part of that is that we had some other automation types, so it wasn't quite as foreign to them as it might have been if we'd been completely manual. And we did see that labor savings. We did see the reduction both in overall labor needed and the type of labor. And so for us, nobody had to be laid off. That was not our problem. Our problem was, can we take more volume with the same staff, or if in some cases, if someone left, did we not need to fill their position? Largely, quite frankly, it's more of the more volume with the same staff being able to accommodate, as quite frankly, some of the other facilities, other hospitals are looking to outsource more of their work. This allows us to handle that with the staffing we have. We've had excellent reliability with the system, and if you recall from the beginning of my talk, that was very important to us. So you might have a single component go down, but you don't have the whole system down. So you just, reroute around that till you get that one particular lane, that belt fixed, and then you're good to go. And then we've definitely had an improvement in just kind of our overarching view of laboratory management, our access to those metrics, that data, so we can see what's going on in the laboratory real time, both from an instrument performance standpoint, but also a workload standpoint. So I will stop there and we will be taking questions at the end. Thank you.
Most of you know Dr. Sharp. She currently serves as a member of the Board of Clinical and Laboratory Standards Institute, member of the Subcommittee for Antimicrobial Susceptibility Testing for CLSI, governor for the American Academy of Microbiology, and is past member of the Board of Scientific Counselors for the Office of Infectious Diseases at the CDC. She has lectured both nationally and internationally and has published numerous scientific articles, I'm sure some of you have read, and also book chapters in the field of clinical microbiology. So, Sue Sharp, thank you very much, and over to you.
And I'm going to close out our scientific part of the talk tonight and introduce you to COPAN's Radian. And Radian is COPAN's automated distribution testing for the clinical microbiology laboratory. And I'm going to introduce you to Radian by going through the study I have on the slide here for you now. And this is a study that was done with the Colibri. You've heard a lot about Colibri from Kileen, and she did a really good job explaining how that all works, as did Caitlin for us as well. So these investigators used the Colibri together with the Radian, the automated distribution testing for susceptibility. And this study was published in the Journal of Clinical Microbiology last year in August, and it was done in Dr. Chikawi's laboratory in Switzerland. So the aims of this study, two aims. They wanted to assess the categorical agreement between the Vitek 2 system, which is what they compared it to, and compared the Colibri Radian under their routine laboratory conditions. So this was done under their real routine laboratory conditions to see how everything worked and how the two systems compared. The outcome measures was not just the accuracy of the new system, but they also wanted to look at throughput as well as the effects on workflow. So they did a rather large study. They did 675 non-duplicate clinical isolate strains. These were strains that were in the laboratory in 2020 when they performed the study. They did 249 Enterobacterales that came through the laboratory naturally, but they also seeded the Enterobacterales with an additional 43 banked organisms that were carbon pentamase producing Enterobacterales. Again, they wanted to tax the system a little bit to see how it would work with these enzyme-producing organisms. So there were 7 New Delhi metallobeta-lactamase producers, 3 KPCs, 16 OXA48-like, and 17 OXA181-like organisms that were included in the Enterobacterales group. They did almost 200 Pseudomonas aeruginosa, over 100 Staphylococcus aureus and an additional 78 coagulase negative staphylococci, and then a smattering of intercocci as well in the study, to give a total of 718 strains that were included in this study, comparing these methods. How they started, they used the Colibri in the study. The Colibri prepared the disk diffusion suspensions, either from technologist-selected colonies on the plate or by using the automated selection feature of the Phenomatrix tag, which will automatically select the colonies for you. They did some time measurements and found that they were able to prepare about 10 organism suspensions in about 20 minutes. Next, the WASP, these suspensions were put on the WASP, and the WASP prepared the disk diffusion plates from the colony suspension. From here, the plates were shuttled off to the Radian inline carousel. Now, the Radian inline carousel contains up to 50 different antibiotic cartridges, so lots of different choices that you can have for the organisms in your laboratory for what drugs you want to place. And you can place different selection protocols, from placing 1 disc to placing 8 discs, and anywhere in between on your 100 millimeter plates. And then the seeded plates with the discs on them were shuttled off into the WASP lab for incubation and imaging. They also then used the Radian Expert System software to automatically interpret the zone diameters, and this can be done either using UCAST guidelines, as they did in this study, but also software is available for interpreting CLSI guidelines as well. When you look at the plates, when you look at them on the screen, the images on the plates, they will show a green halo around the organisms that are susceptible, a yellow if it's intermediate, and red would be resistant. So the Radian result, as I said, were compared to the Vitek 2 results. If the results agreed, then there was no further testing that was done. However, if the results between the two systems did not agree, then they underwent discordant adjudication. So on those isolates, majority of them, the testing was repeated using a broth microdilution system with the sensititer. However, if they were able to see that the discordant results were due to this colonies being visible in the inner zone here of hemolysis due to heteroresistant populations, then they repeated the testing using the E-test, because they wanted to see if those same colonies would show up on the inner zone with the E-test as well. Now, they characterized all their discordant results as either major errors. This is if the Radian and would call or the Vitek would call the drug-bug combination resistant, but the standard test, the reference test, which was the broth microdilution or the E-test, called it susceptible. And then they called a result a very major error if it was susceptible by the Radian or by the Vitek, but was called resistant by the broth microdilution or the E-test system. So taking these all together, there was a total overall categorical agreement in the study with all organisms at 99.1%. They did have a chart I wanted to share with you about comparing these two systems. First with the Colibri coupled to the Radian is a fully automated system. It's very easy to change out the antibiotics. If a new antibiotic comes along, you have 50 cartridge slots that you can stick one of those into. It has a great flexibility if you're drugs change from therapeutics came to you and said, we're going to switch out this 3rd generation cephalosporin for a different 3rd generation cephalosporin. You can easily do that with disk diffusion testing. It's also very cost effectiveness, as we know that the discs themselves are relatively inexpensive. They said that the disk diffusion with the Radian is obviously very reliable for detecting those heteroresistant populations, which are difficult to detect sometimes with broth microdilution MIC testing. And also it's very easy to see test failures. If you had an inoculum that happened to be mixed, we know we can detect those mixed inoculums very easily using a Kirby-Bauer or a disk diffusion system. It was more accurate for the detection of some of the newer resistance mechanisms. This is also applicable to, which I'm glad the authors pointed this out, so it reminds me to tell you that it is applicable to more fastidious organisms as well, because the system and the software does work quite well with blood, Mueller, Hinton, auger as well. The only drawback with the Colibri coupled to the Radian is a drawback that we see with disk diffusion in general, that you don't actually generate an MIC result. Comparing that to the Vitek 2 system, the authors point out that it's a semi-automated method. It's less flexible. It's not very easy to change the drugs in these cards very rapidly. It can be more expensive because you do have to buy the susceptibility cards in panels. It had a lower sensitivity for the detection of these heteroresistant subpopulations. Also keep in mind, different from our distribution testing, you do need purity check plates when you're using a broth microdilution system or an MIC system. So again, that's more consumable costs and more labor time for the laboratory as well. The Vitek 2 did have some problems detecting some of the carbapenemase patterns, and the range of the dilutions in the cards can also be quite narrow. Again, so if UCAST or CLSI would increase a breakpoint or decrease a breakpoint, again, might be difficult to utilize those cards if they don't go high enough or low enough in the MIC range. But it does provide a very good approximation of what the MIC of the organism actually is. So in conclusion, they conclude what we all know, that the workload requirements for manual distribution testing really has hindered the uptake or the continued use of distribution in the laboratory. Many of us were using distribution years and years ago, and we were very excited and very happy to go with the semi-automated MIC testing instruments. Some of us, not all of us, some of us are still doing distribution testing, which is great. But again, because it was more expensive, but it saved us a lot of labor time as well. So there was a lot of people switching away from the manual distribution testing. But these authors conclude that the Colibri, coupled with the Radian, address all these constraints, and they do it with an accuracy that is equal to or better than that of the Vitek 2. They said that they were able to process 80% of the routine susceptibility test using the Colibri and the Radian, that the Colibri and the Radian is also going to be able to help them implement the rapid automated distribution testing directly from blood cultures, which we know UCAST has guidelines for and CLSI now have guidelines for as well. The emergence of new antimicrobial resistance mechanisms can be more easily detected with distribution technologies compared with commercial MIC devices. And again, as was alluded to by our earlier speakers, AST testing reading can also be done at earlier times. This is something that with the Radian, the Colibri, with the continuous incubation, with the software and the imaging that we have, we really think we're going to be able to shorten up that 24-hour period for reading our routine susceptibility testings as well. So if I can just have a few more minutes of your time, we'd like to share with you how this all works and how this all comes together to make a really great automated system for distribution testing. So, ladies and gentlemen, WASP Lab, Colibri, and Radian.
I'll be there before they close. Thank you. Bye-bye.
Alrighty, thank you so much, speakers, for your informative presentations. We will now start the live Q&A portion of this webinar. If you do have a question you'd like to ask, please do so now. Just click on the Ask a Question box located at the far left of your screen, and we'll answer as many questions as we have time for. Let's get started. Our first question is, can Calabri make AST suspensions for other than the Vitek 2 instrument? Dr. Murphy, do you mind answering that one for me?
Sure. So currently the Calibri is FDA approved to make the suspensions for the Vitek 2. However, it can make suspensions for other systems. So depending on your timeline and if you're interested in doing kind of an in-house validation, that's a possibility. But given that capability, COPAN is working on clearance for other systems, and I think Dr. Sharp would be able to comment on maybe what to expect to see next.
Yeah, thank you. We, COPAN is planning to go ahead with FDA clearance for microscan preparations as well. So that's in the works.
Awesome. And how long did it complete validation take, and how many employees did you have focused on this validation? Do you have any tips on the efficient validation process?
I think that's maybe for Dr. Shier.
Okay, so my answer is going to be a lot of it depends. In the first installation, it took a lot longer because we kept having to like move a piece and then revalidate some equipment and then move a piece and then revalidate something else. So that really expanded the timeline somewhat artificially. It was also our first experience. So in the second experience, it was much faster, but also we weren't an operational lab at that point. So we weren't trying to do it alongside patient testing. And we actually had a dedicated corporate team that was working on that validation. So it wasn't really reflective of, I think, what most people's validations would take. Overall, we estimate a full system, so multiple lines, but going into kind of one full system would take approximately a month. But again, that depends on what kind of resources you can throw at it. And then in terms of tips for an efficient validation process, I don't know if this is an efficiency, but if you can get your early adopters, your people, your techs that are super excited about the system on board with helping, I think that's going to, one, build, knowledge on the product. It's going to build enthusiasm for it, and they're more likely to jump in and put in that effort and get it going. So hopefully that will build efficiency, but just getting those early adopters engaged as soon as possible, we found that to be very helpful in speeding the timeline along. And then the final thing I will say is it's probably going to take longer than you budget, because I feel like every validation on Earth takes longer than you budget.
And Dr. Murphy, would you like to add anything about your experiences with how long it took you for a complete validation and how you have an efficient process?
Sure. And I honestly don't remember the exact time frame. Our biggest kind of hurdles were on the IT side. So there's certainly areas of our IT group that are used to working with instrumentation and automation, but they're not usually the people who are also familiar with micro. So I think there was a little bit that tended to be where most of our challenges were, as well as just the testing of when I hit this button on the WASP web app, it goes to this stacker where I want it. So just figuring out those workflows. I think for efficiency, what I would recommend, and I think what was recommended to us, was to make any changes you can make that'll come with automation in advance. So for our wound cultures, we were doing the A to L, L to Z. Somebody was reading those. So we had 2 people on the bench splitting the cultures. You're not going to be able to do it necessarily that way with automation. So we did away with that in advance. Some new codes that we added, we could have probably added before we had started the system, just thinking about how do we want to kind of batch report certain things. So I think that's one of the ways to make it efficient is to start changing the parts of the process you can change without automation in advance so that it makes the transition a little bit easier.
Thank you.
Awesome. Next question. Approximately what percentage of total specimen culture volume at your facility do you have on automation plus PM? And what specimen types are you currently using with the PM tag? And what types are you planning on using tag for in the future?
Sure, I can take that. So in thinking about bacterial culture volume, so not AFB, not mycology, all of that, just looking at our bacterial cultures, about 80% is on automation. We don't have our blood cultures on there for obvious reasons. By far the vast majority. Again, one of our limiting factors is client behavior, getting clients to switch to transport media that is compatible. We, of course, use the collaborative robot to overcome a lot of that. And then we primarily use the PM tag with our urine cultures. So thinking about E. coli, the primary pathogen in urine cultures. So we have that validated. Looking at our aerobic cultures, again, looking at primary pathogens like Staph aureus. We were actually just talking about kind of what's next. We would love to do Enterococcus because it's prevalent both in urine cultures and aerobic cultures. So we kind of get a 2-for-1 on that. So I think that's where we'd like to go next with the Phenomatrix tag.
Great. And what other algorithms might laboratories be able to enjoy with COPAN in the future? Dr. Sharp, do you mind answering that?
Yeah, no, happy to. In addition to what Dr. Shier already talked about, she mentioned in her presentation the beta hemolysis program. So there's an algorithm that will detect beta hemolysis, which can be very helpful for sorting out throat cultures when you're looking for beta hemolytic streptococci. It will sort out those cultures that have hemolysis away from those that do not. So presumptive positives away from your negatives. Dr. Shier also talked about Staph aureus. There's a program that can be used primarily for any source, but really usable for wounds that can sort out those cultures that have Staph aureus in them on routine media, away for those that do not look like they have any Staph aureus associated with them. As she said, there are urine, we have a lot of different urine Phenomatrix artificial intelligence algorithms that can detect growth, no growth, insignificant growth, which is dependent on how the laboratory identifies that. It could be less than 10 colonies. Also mixed growth, again, depending on how the laboratory defines that, which could be 3 or more different types of colonies, and can bin those and folder those into different folders away from your significant cultures. It can also detect E. coli, whether you're using a chromogenic media or a non-chromogenic media, and also do your colony counts for your urines at less than 10 to 50, 50 to 100, or greater than 100 colonies. In addition to those, we have basic growth and no growth algorithms that can be used for basically any source. And we also have several different chromogenic detection modules, which can be used with chromogenic media for screening for different pathogens like MRSA, VRE, Group A strep, Group B strep, CRE or ESBLs, et cetera, can be used basically with any manufacturer's chromogenic media. And then we also have user-defined rules where the Phenomatrix can bring in some patient demographic information. We have one customer that is using this with their urines, so that even if you see a mixed urine culture, they're using a biplate with chromogenic media on one side and CNA auger, blood auger on the other side. So even if the program sees that there's a mixed or contaminated urine culture, it will also let the laboratory know that there are a few colonies on the CNA side. So there's a gram-positive growth there. This is a woman who's 27 years old. So she is of childbearing age. So this culture would be sent over to a bin to investigate to make sure there's no Group B strep on that culture. We have some new algorithms we're looking at briefly for stool cultures, also for screening for Candida auris on a new chromogenic media that's being developed, and also a new auger that's being developed, a chromogenic auger for screening for Streptococcus A and C and G. So lots to look forward to in the future as well.
Great, thanks for sharing. Next question, is the Radian fully FDA approved?
Yeah, I'll take that one too. The Radian, it depends on how you use it, is my how I'm going to basically describe it. As we talked about, the Colibri is FDA approved now for making suspensions for the Vitek 2, and we're pursuing getting those done for Microscan as well. So if you're using the Colibri to make your suspensions for the Radian, then that would have to go through an FDA process. However, if you're not using the Colibri, you're making your own suspensions that you're putting on the WASP to streak out your plates, and then you look at the Radian results afterwards. All of these the Radian results all have to be looked at by a technologist. There's no auto release function of these. So you look at, a technologist would have to look at all the zone diameters. If they disagree, I think as I said in the presentation, if they disagree with the measurement, it's very easy to adjust the measurements around there to what the technologist might feel is more appropriate than what the Radian measured. During the study that I presented, they found that they had to do this less than 10% of the time. But again, a tech does have to look at all these and approve them before they can be released. So an FDA clearance would not be necessary in that case.
Great. Next question. How did you manage to find personnel to take care of the electromechanical issues that such automation requires? Different qualified lab personnel or other?
Dr. Shier, did you want to take that?
I can certainly take that. I can't recall if I went over this in my presentation, but this is definitely a shift for us. When you think about medical laboratory scientists, historically, those that loved equipment went into chemistry. They didn't come to micro. So you didn't always have the most mechanically inclined medical lab scientists in microbiology. And obviously with this automation, there's a lot more moving parts. I talked about the maintenance is a lot of wiping down and whatnot. So there's a little bit of a shift there. But any major mechanical issues, we call for service. We're not going to mess with any major issues. Fortunately, we've really not had a lot. The uptime has been really, really good. So we're not really looking for qualified, people or people with, mechanical engineering abilities to do this. If it reaches that level, we're going to rely on COPAN for that support.
Awesome. And any idea how Colibri spotting works for more fastidious organisms, Dr. Murphy?
Yeah, so we've tested a variety of organisms with our verification, and we don't see anything that comes up pretty much in our daily practice where we have any issues with spotting any particular types of organisms. We do still maintain kind of best practice or do our best to do that. So certain fastidious things, if there's a concern that we want to screen it offline first before we put it on the Maldi or the Colibri, as well as if it's something like a urine with faint growth, we'll typically just pull it off to do a gram stain. So it certainly isn't something that we've seen to come up on our day-to-day operations. We do have some data from the study we showed that we had done the abstract on, and are trying to add some more fastidious isolates on that to kind of drill down a little further. In general, I think you saw from the video Dr. Sharp showed at the end of her presentation, it's a very minimal spot that the Colibri makes compared to what we're used to attack, kind of coloring in the whole circle. So it doesn't really need a lot of biomass, but certainly can't make it appear where it isn't. So I think for really, really tiny colonies, you might have some issues, but otherwise we haven't encountered any issues with spotting fastidious organisms using the Colibri.
Great. And based on your experiences, what would be your suggestion to laboratories considering purchasing automation, but are also facing moving to a new space soon? Should they wait for the new space or implement in the current laboratory and move to the new space when it is ready?
So we have zero experience with moving a COPAN WASP lab. So I can't really speak to how that process would go, but I think it would probably be a better use of your time to really plan out that new space and plan the automation around that and what needs to happen for that space. rather than installing it and then having to move it and then, revalidate it again. So that having no experience having moved it, that's just kind of my perspective, knowing what's involved with the space planning and the installation and validation of one of these systems.
Yeah, I'll just add to that we have had helped customers with moving their WASP lab, and it can be done.
Great. Well, looks like that is a wrap on our questions. Thank you so much, Dr. Murphy, Dr. Shier, and Dr. Sharp. Thank you again for your time today and your important research. We would also like to thank LabRoots and our sponsor, COPAN Diagnostics, for underwriting today's educational webcast. Before we go, I'd like to thank the audience for joining us today and for their interesting questions. Questions we did not have time for today and those submitted during the on-demand period will be addressed by the speaker via the contact information you provided at the time of registration. This webcast can be viewed on demand. LabRoots will alert you via email when it's available for replay. We do encourage you to share that email with your colleagues who may have missed today's live event. Until next time, thank you so much for your time and goodbye.